My grandmother had cancer when I was, probably in about second grade. And it's just unbelievable in the 20 years since she died from her cancer, how much progress and change and development has happened in the field. First time a patient comes to see me, they already have a diagnosis, and the vast majority of what I see are patients who have blood cancers, things like acute leukemia, AML and ALL, myelodysplastic syndrome, myelofibrosis, multiple myeloma, some types of lymphoma. And they're coming to see me kind of specifically to talk about a blood stem cell transplant or a cell therapy option for their disease. The first visit, it can be kind of a long visit, kind of a dense visit. The most important thing is really getting to know the patient and their family at that first visit, because we're kind of forging what's ideally going to be a relationship that's going to last many, many years and probably the rest of their lives. From there, we review the diagnosis, we talk about what a bone marrow transplant is, we kind of talk together and see if it's the right fit for that patient, that disease, and that family. Sometimes we have to have the conversation a few times to kind of, make sure all the details are understood. And, that's the beauty of it, though, is most of the time we're working to cure the cancer. That's the whole goal of a bone marrow transplant, and some of these cell therapies, we're hoping to put these diseases into remission for good. So there's optimism, there's hope, but it's still scary and can be a lot to talk about and process. The most rewarding part of my job, I would say a big component of it are the depth of the relationships that I'm able to form, or that I have the opportunity to form with patients and their families. Once I see someone, they're kind of with me for the rest of their life. So seeing the patient on the other side of transplant and their family and their kids grow up and things like that, that's incredibly rewarding to know that, we've given them time with our treatments, and hopefully quality of life along with that. It's really an incredible privilege for them to put faith and trust in me, and to kind of walk through on that journey together is a very special aspect of the work that we do.